For many Indians, the horrors of the second wave were compounded by an acute lack of infrastructure, acute shortage of everything from medication to hospital beds and yes, basic oxygen to breathe. The fact that people died because of a lack of oxygen are really not up for debate. There is enough evidence to show that there are families who have stood in lines to refill cylinders and have not been able to save their family members who perhaps could have made it just because oxygen ran out. In fact, in the months of second wave, the amount of oxygen that India consumes was up 300%. This is something that the health ministry themselves are saying. But the health ministry today is also saying that there are officially no deaths reported due to lack of oxygen in COVID-19. Now let's look at what that statement says and why it has shocked so many. All of those people who lost loved ones, all of those who saw their near and dear gasp for breath till the very end. It's because it seems like there is no recognition of what was totally a failure of the state. Here's what the health ministry has said in a written response to a question raised by KC Venugopal. They said detailed guidelines for reporting of deaths have been issued by the health ministry to states and union territories. They say health is a state subject, and they say no deaths due to lack of oxygen have specifically been reported by states and union territories. Technically, they may be correct. Perhaps states and union territories have not specifically classified, categorized and reported deaths of people due to a lack of oxygen. Perhaps they were not asked to because the guidelines issued by the central government may not have specifically earmarked that please calculate and mark down those who died because of a lack of oxygen. Does that mean people didn't die because of a lack of oxygen? Well, no one can really say that. It's a troubling statement which comes on a day when the new health minister, who has a tough task cut out for him, Mansukh Mandavia, took to the floor of the Rajya Sabha. At the end of a 4-hour debate, he was responding to a number of queries from the opposition members and included a promise that the government is indeed ready to tackle the third wave. Listen in.
कि यहाँ कई सम्मानीय सदस्यों ने कहा कि भारत सरकार आंकड़ा छुपा रही है। भारत सरकार जो स्टेट गवर्नमेंट आंकड़ा भेजती है उसको कंपाइल करके पब्लिश करती है। भारत सरकार का काम होता है उसको पब्लिश करने का, उसके अलावा हमारा कोई काम नहीं होता है। ना ही भारत सरकार ने किसी को कहा है कि हम कम आंकड़ा दीजिए, ना ही यहां से किसी को कहा गया है कि कोविड के पेशेंट को कम बताइए। नहीं, बताने का, ऐसा करने का कोई रीजन नहीं है।
All right, to speak on what the preparation is for the third wave and the fact that the government today says that officially there are no specific instances of those dying due to a lack of oxygen, I'm joined now by Dr. Jayalal, the National President of the Indian Medical Association. Dr. Rahul Pandit, Director of Critical Care at Fortis, joins us on the show, as does Anant Bhan, Global Health and Policy Expert. Welcome to all of you. Dr. Jayalal, I want to know your thoughts first. Now, explain to us why this could have happened. Is it because that there is no specific guideline to actually enumerate the kinds of deaths that took place due to COVID-19 second wave? And this would, of course, include those who could have been saved. Is there anyone tabulating what has really happened?
Yeah, absolutely. There is no registry is maintained, and the exact cause of death is there is either audit or something is not done. And what the Honorable Minister has said is absolutely true. They do not have a data. More so, they were not intended to collect this data. When we talk that this is very important for us to understand how the disease is progressing, how the infrastructure difficulty, what changes we need to make. The data is always important. But unfortunately, the government is not having the data. Even for the doctors who died, we have 1,540 doctors have died. The data is not with the government. We know what has happened in Batra Hospital on May 1st, including the gastroenterology, Dr. Himdani, who was working there, has to die. It was well reported in all the papers as published. Even the High Court has to intervene in that time and saying that more than 5 people died due to the oxygen lack. Maybe the government is not having the data, but that is not an excuse for us to say that people have not died due to oxygen lack in this country. There must be a system should be ensured, not only the oxygen lack and the infrastructure and the number of people dying and what level of the disease they are dying. So that data has to be maintained. Then only it will be helpful for us to plan future and go ahead in the future activities.
Absolutely. Anand, how do you look at this? The statement coming in from the health minister and from the health ministry actually specifically to a question where they say that there are no specific instances of deaths due to a lack of oxygen. That is shocking to say the least.
Thank you for having me. Yes, it is shocking, and it's also in many ways disrespectful to all the lives that were lost. Now, again, you can go creatively into the way the wording was done to say that, well, we haven't received any reports from the states to say that there was a loss of life due to a lack of oxygen. And you can leave it at that and say that, we're just ending up collating what has been shared with us by the states. But of course, accountability lies at various levels, and that includes the central government. For all of us have seen the kind of mayhem which happened during the peak of the second wave. In fact, the second wave has not gone away. Manipur right now is in lockdown. We still are in the second wave. And to have statements like this come through at a time when Parliament should seriously be discussing what do we need to learn from the experience of those 2 months when people were struggling to get beds, when people were struggling to get simple supplies like oxygen. And this applies even to doctors, as Dr. Jayalal said. We have lost senior doctors because hospitals ran out of oxygen. So to say that, well, we didn't really get those reports and hence that this is what we're going to tell Parliament, it's unfortunate that's what we heard today. Hopefully what we see in Parliament is an open, transparent discussion around accountability, around what we need to learn and what are we going to do to fix the health system in this country so that we don't see that kind of, negativity, that kind of unfortunate circumstances, which is still causing a lot of stress and anxiety, and perhaps has a longer-term mental health implications.
It's disappointing to say the least when you see the first proper conversation around COVID-19 after the second wave between our lawmakers come down to point scoring. Look who ensured that there are enough vaccinations in place. No, we had vaccinations and the capability even before this government came into play. Look which states did better, look which states didn't. Really, the fact is that everyone has suffered from COVID-19, and yes, we have been found wanting. The fact that the health minister changed is testimony to that. But I want to come to the point specifically of oxygen. And Rahul Pandit, Dr. Rahul Pandit, I have a very specific question for you. Is anyone in any system, in any hospital also, actually tabulating and counting the possibility that someone died because of a lack of oxygen? The thought that comes to mind is, at what point would this data even originate? A doctor would have to write down somewhere that yes, this patient could have been saved if there was enough oxygen, isn't it?
So, good evening. The way the data is tabulated, it is actually looked at the diagnosis which is written on a death certificate. And if you have a diagnosis written on death certificate, currently the most common diagnosis is COVID-19 pneumonia with organ failure or whatever other possible comorbidities the patient may be having. That is how the death gets reported, and that's what the tabulation happens. Now we will have to obviously look at the data in terms of whether we can improve upon that, and there is always a scope for improvement. I am always a person who thinks that we have to move forward. This is something which now we will have to sort of tabulate and keep it ready. That was there a resource problem which needed to be corrected, and because of which a life was lost. I might sound that why was it not done until now, but it's not been done currently. So let's recognize this as a problem and move ahead. I think in general, Tamanna, if you ask me, the topic of the day show is that how are we prepared for the third wave? We now know what we should not be doing. So I think that preparation is extremely
Yes.
important. What we should not be doing. So I might just enumerate a few things. We should not be using drugs like
Yeah.
hydroxychloroquine. We should not be using drugs like azithromycin or doxycycline. We should be using appropriate doses of steroids, not long doses, not long courses of steroids and high dose of steroids. We should not be putting patients into oxygen requirements to keep their saturations above 96, 97. Try and bring down the saturations to a lower 90, say 90 to 94%, which have shown to have increase in the patient's outcome, betterment of the outcome, decreases the mortality. These are the things which have actually helped us into understanding the whole process. And we should be looking at these things, that what can we improve upon. We can look at bed allocation of the central system, which Mumbai has done so exceptionally well. We could look at oxygen distribution equitably, which Mumbai again did so well. So I think these are the points which we should be looking at. We need to look forward that if at all a third wave comes and it comes in the same ferocity of what we had, then what do we do?
No, but you're absolutely right, Dr. Pandit. But in order to look forward, we also have to understand what we have just experienced, which is not back in the past several years ago. This is just a couple of months ago. And as Anand says, in some places, the second wave is still not petered out. Just a follow-up question. You said that most commonly what's being written on death certificates is COVID and the cause is pneumonia, which eventually kills the patient. But we are also seeing a number of patients die because of the impact of COVID, but at the time of death, they are no longer COVID positive. The disease has perhaps wreaked havoc in their body and they've eventually died of a cardiac arrest or some other such issue. They're not being recognized as COVID deaths. Is this something also that needs to be rectified in the broader question of how do you determine whether someone died of lack of oxygen or not, and who will count those numbers?
So in the death certificate in Maharashtra or Mumbai specifically, the primary cause of death is written. Below that, you may have the secondary cause of death, in which you can write down patient of COVID-19. And then you may also write down in a patient who had these comorbidities. So there are ways of writing a death certificate, and the data needs to be collected of all three. Just like we collect data for pregnant women who lose their life, unfortunately, there is always a place to write down, is the patient pregnant. We may have to sort of put up a special column there to say that was this patient COVID-19 in the last 30 days or 40 days, so that can be sort of figured in or numbered in, and we could have that understanding that yes, there was a COVID before, though the immediate cause of death was not COVID-19, but the patient did have COVID in the last preceding 4 or 6 weeks. I think something that of that sort can be sort of thought of and implemented. It will give us a bigger understanding of how the deaths can be tabulated and how we can look at our mortality data in a more objective way.
Dr. Jayalal, let me come to this specific question of collating data objectively. Today, the minister said in Parliament that the central government has no intention and has never asked any state to cover up any COVID deaths, but there are numbers being matched now once again, and some states have reported a higher number of deaths. There are estimates doing the round that there could be 10 times more people who have died. We still don't know. Do we now need to have a clearer line of communication from the end of the clinician as well as to what exactly has happened?
Yes, it is absolutely necessary. Now, the Honorable Supreme Court has come forward. The responsibility of writing the appropriate diagnosis of the death rests upon the doctor who treats. And even if the government is going to give an order that don't write COVID, and it is a responsibility of the medical fraternity to do not budge to the pressure, if at all, if there is any pressure, to write exactly what is the cause. One problem we also face is we need to check it whether they are RT-PCR positive is only accepted by the insurance sector and the government as a COVID. But there are many patients we have seen without that RT-PCR positive with the CT finding, and they were treated as a COVID-like infection. So like COVID, post-COVID sequelae, the COVID-like infection should be also included in that. But I know it is the responsibility of the doctors community. Although explicitly none of the government or none of the administrators have said you need to cover up. But it is an evident fact, it is a well-known fact. There are many reports, many states, the reports what actual death and the reported deaths were much, much lesser than what is happening in actually. But I think this is a time now all of us have to wake up and say it very plainly. It is a responsibility of the patient also and their relatives to ensure that their death is properly documented. And if they are died due to COVID or COVID sickly or COVID-like infection, it should be included in the case sheet and included in the death certificate which has been issued to them.
But sorry, Dr. Jayalal, I must come here. How can you make this the responsibility of the patients' families who are distraught that they have lost someone? A lot of them might not even understand the legal implications of this. Many of them may not even be literate. Can we really pin this on the patient's families?
No, I am not saying that you have to pin it on the patient family, but they are also responsible. We cannot just say that patients are ignorant, they do not know. But now there are a lot of options the government has come forward. There is a provision of helping them. There is an insurance sector is there. When there is both the parents are died, the child is going to get benefit. So it is somebody who is responsible to also see to that their proper death is documented. Maybe it is a patient's relative or the local councillors, local panchayat people, and the responsible people should be responsible for it. But the pinning up should be on the medical officers, and who is treating should write appropriate cause for their death should be written.
Yeah. You know, I think we have to go now beyond the technicalities of what should be written on the death certificate, what states should technically be reporting in their numbers, and should the central government be technically waiting for the states to report the right numbers, to what we need to fix. Anant, looking to preparations for a third wave, do you think that we have at least learned some lessons and have ironed out those lacunae in the systems, where if God forbid there is another big ferocious bout with a new mutation, we'll at least not see that extent of devastation? Do you feel confident of that?
One hopes so. I think, as Dr. Pandit was saying, there's now much better learning of how to handle COVID-19 from a medical perspective. I think states and the center have also realized that there is a need to build infrastructure. What I'm not so sure about is that whether we have our human resources sorted out. You can have the best infrastructure, but if you don't have the manpower, if you don't have adequate trained providers to run those services or that infrastructure, it's not going to really magically be run by machines. You need, those providers to be there. What we also don't have is adequate vaccine coverage. We have given out a lot of vaccines, but we still need to enhance our vaccine coverage, because we know well enough that the more people who are vaccinated, even with just one dose, it's highly likely that they will be protected against severe infection and death. We have to sort out the issue of rural areas where still there is a dearth of quality health system access. We need to figure out, is there something special which could potentially put our kids at risk? Because at least there has been some cases of multi-inflammatory syndrome in children. And we just need better genomic surveillance so that we are able to catch on variants quickly, and more transparency and accountability and better data. So if we get all of that right, then hopefully we will have, if any future waves come through, we will be much better prepared and be able to handle it better.
Absolutely. The fact is that we can just only hope we don't come across a third wave. The sero studies which show that 2/3 of the population may have already faced COVID-19 one way or the other and has developed antibodies is heartening, in the sense that it gives us hope that we won't come across the third wave. But you still have 40 crore people who are vulnerable. Children could still end up being vulnerable. We have seen revival and resurgence of infections because of the Delta variant in countries which are highly vaccinated as well. The deaths are fewer. So we don't know what we are going to face next. The least we can hope for is transparency from our policymakers and leaders on this. I want to thank all of you for joining us in the first discussion this evening, where we were looking at what the claims are on a preparation for a third wave and how close we are.